Hello, and welcome to today's webinar, everyone. Thanks for joining us. My name is Rob Cowell, and I'm president of the Canadian Institute of Food Science and Technology. On behalf of CIFST and Food in Canada, Canada's only national food and beverage processing magazine, welcome to Table Talks, where we bring you regular webinars and give you access to some of the leaders in the food and beverage industry. If you haven't already, please visit CIFST's website for a list of upcoming webinars, which we will continue weekly into July. And if you are a member of CIFST, registration for the entire series is free. So today's topic is COVID-19 and food safety, separating fact from myth. And before we kick off today's session, I want to mention that if you have any questions, you can write them in the question box, and I will moderate the questions at the end, and our speaker will attempt to answer them all before the end of our webinar. So now I'd like to introduce you to our speaker. After completing a B.Sc honors degree in microbiology at the University of Guelph, Dr. Lawrence Goodridge completed both his M.Sc and Ph.D. degrees in food science with emphasis on microbial detection and foodborne pathogens, also at Guelph, before leaving for a postdoctoral fellowship to continue his training in microbial food safety in the laboratory of Dr. Michael Doyle in the Center for Food Safety at the University of Georgia. Prior to returning to Guelph, Lawrence has held faculty positions at the University of Wyoming and Colorado State University. More recently, he was the Ian and Jayne Munro Chair in Food Safety in the Food Science Department at McGill University. In January 2019, Lawrence joined the Department of Food Science and the Canadian Research Institute for Food Safety as full professor, where he holds the Leung Family Professorship in Food Safety and director of the Canadian Research Institute for Food Safety, and conducts research related to control and detection of pathogenic microorganisms, including viruses, bacteria, and parasites. Dr. Goodridge has published more than 95 peer-reviewed journal articles and book chapters, and has been awarded more than $25 million in research funding from US, Canadian, and international funding sources. So ladies and gentlemen, please welcome Dr. Lawrence Goodridge.
Well, good afternoon, everyone. And thank you for taking some time out of your day to come to this webinar. And what I'd like to do over the next hour is really have a discussion regarding COVID-19 as it relates to food safety and food production. And I really would like to separate facts from the myths. We know there's a lot of information out there. A lot of it's contradictory. Even scientific studies, most of which have not been peer-reviewed, so they are preprints, seem to contradict. So what I'd like to do is give an overview of the virus that causes COVID-19, some of the characteristics that are relevant with respect to understanding how the virus is spread, but also how we can control it in the food processing environment. So we'll start with background. So the virus that causes COVID-19, or otherwise known as coronavirus disease 2019, is called SARS-CoV-2 for short, or severe acute respiratory syndrome coronavirus 2. And so this virus is a coronavirus. And coronaviruses are a very large family of viruses that typically cause mild to moderate upper respiratory tract illnesses. And a good example of that is a common cold. 4 of the 7 known coronaviruses that sicken people cause only mild to moderate disease. So while there's a lot of coronaviruses out there, the vast majority of them infect non-human animals. We only know of 7 coronaviruses that infect people, and 4 of those cause only mild to moderate disease, such as the common cold. However, since 2002, 3 new coronaviruses have emerged. And we see SARS-CoV-2 in 2002, which is the first coronavirus, so also known as SARS-CoV-1, MERS, Middle Eastern Respiratory Syndrome, in 2012, and of course now SARS-CoV-2. And these viruses have emerged from animal reservoirs and have caused widespread illness and death. So the majority of coronaviruses, I've said, infect non-human animals, and sometimes they can jump to humans. And when this happens, this is called a spillover event, and this can lead to disease, such as the disease that we are seeing now. And so in this case, SARS-CoV-2 is believed to have come from bats. And so it seems that the current data suggests that this emerged or evolved from a bat-borne virus, and that it can now infect humans. A lot of the data I'm going to be presenting today is as of the current time. So in other words, it's what we know currently. I like to say that because that is subject to change. We're still only a few months into understanding this virus. Actually, we haven't really even begun to understand it yet. We're just trying to control it, trying to stop people from becoming infected. So the research to understand the virus has really only just begun. And that means that what we know today is subject to change tomorrow. And that's one reason why there appears to be contradictory information in the media. What appears to be contradictory is really in reality updated information based on increased information that we know. So currently, we know that the infection rate, also known as R0, R0, pronounced R0, which means how many, if a person is infected, how many people will they infect? So R0 is thought to be between 1.4 to 3.9, meaning that each infected person can infect between 1.4 and 3.9 additional people. And what that really means, especially if we start to get up to the higher end of that range, is that the virus is quite infectious. We also know that the virus is primarily spread between people through close contact and via respiratory droplets from coughs and sneezes. And that last point is really important, and we'll come back to that over and over in this talk. So what we're seeing here is an illustration of what the virus particle actually looks like on the left, and then on the right is a schematic diagram. And this is also important to understand, especially with respect to how we can control this virus in our homes and in food processing settings and so forth. So if we look at the right, the schematic diagram, we can see at the top the spike protein S1 and S2. So that protein is primarily responsible for the virus binding to the cells in our body that they infect. And the receptor that they use on the cells, on the human cells, is called the ACE2 receptor. And that's important because there is some thought that in addition to contracting the virus through inhalation, that perhaps one could contract the virus through ingestion. And that's because not only cells in our respiratory tract have the ACE2 receptor, but also cells in our intestinal tract. And we'll talk about that a little bit later. Then you see the nucleocapsid, which is another protein, the membrane, the envelope, and the RNA, which is the nucleic acid, which is responsible once the virus infects cells for taking over our cells and making more copies of this virus. What I want to really emphasize here is that this virus is enveloped. And that's good news. If there's any good news from this disease and this virus, the fact that it's enveloped is good news, because what that means is that it's quite easy to kill with common disinfectants and cleaners. And so that's in contrast to non-enveloped viruses like the noroviruses or hepatitis A virus, which can be quite difficult to kill. The fact that this virus is enveloped means not only is it easier to kill, but it's also less hardy in the environment. So let's talk about what we know about SARS-CoV transmission. So current data suggests that transmission, person-to-person transmission, happens through close exposure, as I've said, a close exposure with an infected person, and that transmission happens primarily through respiratory droplets produced when that infected person might speak or cough or sneeze. And if that happens, then those droplets are expelled into the air, and and those droplets have virus particles in them, and so the droplets and the virus particles can then land in the mouths, noses, or eyes of people who are nearby, or they could possibly be inhaled into the lungs of those who are nearby. So the mouth, the nose, the eyes, and the respiratory tract all have in common the fact that they have mucous membranes, and that is primarily the way by which this virus enters the body. Other transmission routes have been postulated. One of those is contact with contaminated surfaces. So if let's say somebody was to sneeze on a surface, and then you touch that surface and then touch your eyes or nose or mouth, then that is one potential other route that the virus can lead to infection. There's been a bit of talk recently about airborne transmission, and is it likely? So I would say that our current knowledge tells us that it's unlikely, certainly unlikely with respect to person-to-person transmission over long distances. And I note that to date, there have been no published reports of airborne transmission. However, as I've said, this is current knowledge, and everything is subject to change. So it's thought that the infectious dose is somewhere between the high hundreds to low thousands of this virus. So what that means is the number of virus particles needed to cause an active infection is somewhere between the high hundreds to low thousands. And that's an estimate. That's not based on any scientific study. So we have to remember that this is just an estimate. When earlier in the slide, I said R naught was 1.4 to 3.9. What currently we're seeing would put it somewhere between 2 and 3. So let's just assume that the infectious dose is 1,000 virus particles. Here are some examples of how infection could occur. You could receive 1,000 virus particles in one breath, or from one eye rub. So if you were to touch a surface and touch your eye, you might get 1,000 virus particles into your eye, depending on how many were on that surface. Or you could receive 100 viral particles inhaled. So each time you breathe, you could inhale 100 virus particles, and over 10 breaths, you would then get 1,000. Or if there were 10 virus particles over 100 breaths, you would get an infection. These are just some potential examples. And what these examples really highlight is that in order for a successful infection to occur, the formula is exposure to the virus multiplied by the time. So how long, it's not just exposure to the virus, but it's how long you were exposed. And this is really important, because this begins to explain why we're seeing, for example, people becoming contaminated in places like meat plants as exposed to, as compared or contrasted to the environment, the outdoor environment. So successful infection is equal to exposure to the virus times multiplied by the time. And this is something that we will reinforce over the next few slides. We also know that most people tend to get infected in their own home. So this should give us the first clue. Being inside in an enclosed setting it vastly increases the risk of becoming infected if there's another infected person there, as compared to being outside. A household member would probably contract the virus in the community somewhere and then bring it home, and then sustained contact with household members leads to infection of many of those household members. So that could lead to the question, where in the community are people becoming infected? Some other questions, should we be worried about grocery stores or outdoor activities like bike rides and running, all of which have been in the media with different sources expressing different levels of concern about those places in the community. So we will we'll spend the next few slides really diving into how people get infected and answer these questions. So here's a graph that shows the number of droplets released by various sources you know, if somebody is infected and they release the virus in droplets. This shows the different sources and the numbers of droplets released. So a cough, about 3,000 droplets are released. A sneeze, 30,000 droplets. And then breathing. A small breath, probably only 50 droplets or so. A large breath, about 5,000 droplets. And again, these are estimates. So we shouldn't take this to be exact. But this gives you an example of the sources, the different sources, and which would increase the chances of infection. So obviously a cough, a sneeze, and a large breath would be things of concern. And I note that we're not including if people block that cough or sneeze or breath with their arms. This is if they were to do these things unimpeded. So this is a study that was done at Western University in collaboration with Sunnybrook Hospital. And I include it here because it really shows what happens when a person coughs and why coughing is certainly one of the activities that can lead to infection. And this is why wearing a mask is useful. So in this study, what they did was they built a cough box. So on the left side of the slide is this apparatus. You can see it's an enclosed box. They call it a cough box. You can see a person sitting in a chair. They would put their face up to the apparatus, a seal would form, and they would cough into the apparatus. And then you can see there's high-speed cameras to capture what happens. And so I'm just going to click through on the right side, and you'll see the droplets. In the blue part of the screen, you can see the initial cough, and then I'll click through and you can see what happens over time. So you can see as the cough happens, droplets, this is after 1.35 seconds now, there's a cloud of droplets. Not as many as in the initial one right after the initial cough happened, but still some droplets. Here's 2.7 seconds, so less droplets, but there's still some there. And then finally, 4 seconds. So even after 4 seconds, we still see droplets in the air, and they've moved a certain distance away from the person coughing. And the study found that if a person coughs unobstructively, as much as 10% of the fine droplets from the cough remain suspended in the air after 4 seconds. So in a cough, there's heavy droplets and fine droplets. The heavy droplets will drop out of the air right away, but the fine droplets can remain in the air as much as 10% after 4 seconds, according to this study. So that is a risk factor for contracting the disease. So related to the droplets is a number of virus particles that are released into the environment through droplets. So again, we have our sources: coughing, sneezing, and breathing. Coughing and sneezing are estimated to release up to 200 million virus particles So a single cough or a single sneeze in those droplets would release up to 200 million virus particles. Breathing is estimated to release 33 particles. And that really is not that data does not come from any SARS data, but really what we know about influenza. So influenza, if somebody was infected and they breathe, they would release on average about 33 particles. And then speaking about 330 virus particles. So coughing and sneezing are really the main sources, and perhaps speaking as well. Keeping in mind that the infectious dose is estimated to be about 1,000 virus particles. So if a person coughs or sneezes, then those 200 million particles will go everywhere. So some of it will hang in the air, some of it will fall to the surface. You know, the virus in the fine droplets will hang in the air at least for 4 seconds, as we've seen. So, the heavier droplets will fall onto surfaces. A lot will fall to the ground. If you are face to face with a person and having a conversation, and that person sneezes or coughs at you and they're infected, then you are at very high risk to become infected yourself. Because obviously it'd be very easy to inhale at least 1,000 virus particles. If someone coughs or sneezes, then that isn't directed at you. It can still cover, you know, a large area of a modest-sized room, and that can lead to again infection. And because if a person was to then enter that room within a few minutes of the cough or sneeze, and they took a few breaths, there's certainly the potential to receive enough virus to establish an infection. In terms of general breathing, though, it's unlikely that that is a source of infection, because even if you remember each breath on average estimated to release 33 particles, you would have to be in very close proximity for a long time, at least 30 minutes, to receive the infectious dose. So we really know that coughing, sneezing, I'm going to add speaking in there, are the 3 main ways that people can spread the disease, the virus. I also want to talk a little bit about bathrooms, because bathrooms have a lot of high contact surfaces, and fomite transfer can be high. So fomite refers to particles that can transfer the virus, such as droplets. We also know that people people can shed high levels of SARS-CoV-2 in feces. This was shown early on, and this led to the speculation I said earlier about whether people could get the virus through ingestion, whether you could get it through food, whether you could get it through the fecal oral route. I note that all major governmental food agencies, so this would include the Canadian Food Inspection Agency, the United States Food and Drug Administration, and the European Food Safety Authority, have all consistently come up with statements saying that they have not observed any foodborne route of contamination. Nobody's ever been observed to contract the disease through ingestion of food. However, you know, because people shed it in their feces, and in some cases in high levels, this question of could one contract it via the fecal oral route remains to be answered. Certainly, if one is shedding the virus in feces in high numbers and then a toilet is flushed, the potential for the virus to be aerosolized is high. And so because of that, bathrooms, especially those in public or workplace settings, really should be treated with extra caution. If there's a lid on the toilet, it should be closed before the toilet is flushed. And certainly, if there's no lid, you know, many public toilets don't have lids, then the toilet should be flushed with one's face facing away from the toilet. So let's talk a little bit now about the food industry and COVID. And we've seen lots of reports in the US and in Canada of infections in meat plants, a lot of infections in meat plants, and then to a lesser extent, infections in other food processing environments. So why is this happening? Well, in meat processing plants, there's several things that conspire to spread the infection. We have densely packed workers. They have to communicate to one another amidst loud noises of industrial machinery, which means they're shouting. If you're shouting, certainly there's the increased chance of propelling more droplets and hence more virus into the environment. It's very difficult to maintain social distancing in a meat plants and other food production facilities. Also, there's common use areas like wash stations, bathrooms, we already talked about, locker rooms where people congregate. Remember what we said about closed spaces and the virus being spread in that space, and then people being in there and coming into contact with the virus. Various interventions have been tried, including physical distancing, plexiglass barriers, and PPE, with little success. Okay, and that's just because of how infectious the virus is, and also the extreme challenges that one faces when working in an enclosed area. And this case study really shows this. So this is a paper that was published from China, and it detailed an outbreak that happened in a restaurant there. And so on the left side of the screen is the schematic of the restaurant, and you can see a yellow circle denoted as A1. So what happened was there was one infected person. It's thought that dined at this restaurant. So that's A1. So they're sitting at this table, a round table with 9 friends. You can see them there. Dinner took approximately 1 to 1.5 hours. Okay, so this infected person is dining with his friends or her friends over a period of 1 to 1.5 hours. They're infected, they're speaking, they're breathing. Who knows if they coughed or sneezed? But it's likely they didn't sneeze or cough because the person was asymptomatic. So let's assume that they didn't cough or sneeze. So they're releasing low levels of virus into the air from their breathing, and I would say potentially from their speaking. This paper was published earlier on. Since then, we've identified speaking as perhaps another risk factor, as I mentioned. So let's say that they release low levels of the virus into the air from their breathing and speaking. At the very right hand of the diagram, you'll see an air conditioner and arrows which denote the flow of air. So the airflow in the restaurant was from right to left. And approximately half of the people at the table A, became sick over the next 7 days. Those are the people in the red circles. So you see people right next to the infected person and people across the table. Also, 75% of people on the adjacent downwind table became infected. So that's 3 or 4 people at table B became infected. Okay, and that makes sense because there's virus particles in the air. The wind is blowing in that direction, or airflow is blowing in that direction, which blows the particles, and people could inhale that. But also 2 of 7 people on the upwind table, table C, became infected, and that was believed to have happened through turbulent airflow. So the air, essentially the air recirculating back towards the air conditioner. It's important to note that no one at tables E or F became infected because they were out of the main airflow from the air conditioner on the right to the exhaust fan, and so forth. The exhaust fan is on the left of the diagram. So, we might look at this and say, well, see, this shows that the virus one can get through the air. It's airborne, and that could be the case. But it also could be the case that the air blew the virus onto contact surfaces that people touch. Remember, this is a restaurant, and they're touching utensils and the tables and so forth. So this really, the take-home point here is really to show what happens in an enclosed area and how people can get infected in an enclosed area. And I think this is why we're seeing such challenges with meat processing plants and other food production facilities. Here's another study that came out regarding virus survival on various food contact surfaces. This was in the media about a month ago, probably 6 weeks ago or so, maybe a bit more. And there's quite a lot of media coverage about this. So this is virus survival on several surfaces and as aerosols. And I note that in this study, they actually cultured the virus. So a lot of studies that have come out have been criticized because of the methods used to detect the virus, which are based on amplification of the nucleic acid through a process called polymerase chain reaction. And what that does is detects the nucleic acid, but it doesn't tell you, so it tells you that the virus is there, but it doesn't tell you if the virus is infectious or not. The virus could have, remember I told you that it's an envelope virus and it doesn't actually survive well in the environment. So the virus could not, maybe the virus was there, but it's not viable anymore. It's not infectious. So the PCR method would not tell you that. What you really need to do is culture the virus in animal cells to know if it's infectious. So in this study, that's what they did. And you can see, and they're comparing in the red lines are SARS-CoV-2 and the blue is SARS-CoV-1. And so basically you can see that SARS-CoV-2 and SARS-CoV-1 are similar in the way they survive on various surfaces. In aerosols, they stopped sampling after 3 hours, but you can see that there's probably 3/4 of a log reduction. That's the graph on the left side within 3 hours. So it's getting down towards the detection limit. On copper, within 8 hours, virus could not be detected. Cardboard, about 24 hours. Stainless steel, about 48 hours, and plastic, about 72 hours. And this was these materials were maintained at room temperature as well as 40% relative humidity over a week. It's important to understand that relative humidity can also affect survival of the virus. So relative humidity plays a factor in the survival and spread. So that past slide shows us that certainly there's a potential for the virus to be on these surfaces, and so we have to figure out ways to remove them. And that brings me to this slide. And as I said earlier, if there's a silver lining in this whole thing, it's that SARS-CoV-2 is an envelope virus, so very easy to kill relative to other microorganisms. And you can see that here. That of all the different microorganisms listed here, envelope viruses are at the bottom in terms of least resistant to disinfectants. So what that means is they're very easy to remove with common cleaners. So that's the take-home message here. And with respect to hand hygiene, soap will inactivate them, hand sanitizer will inactivate them. So the virus is easy to remove. With that said, it's still important to understand, how the virus persists in the environment. So that's why studies like the food contact surface study I showed you a couple slides back is important. It's also important to develop a sound cleaning and sanitization approach to ensure that there's no virus on surfaces. One study previously evaluated surfaces at 23 hospitals, for example, and found that on average only 50%, 49% of all terminally cleaned high-touch objects were effectively cleaned. So that's important, given the fact that people could touch, high contact surfaces and then touch their face and infect themselves. So really, there should be a focus on programmatic approaches to cleaning the environment. The food processing environment includes the right products, the right tools, and improvement studies to consistently decrease the bioburden. Now, there's been a lot of discussion in the food industry about this, and various opinions range from, well, if you have a good standard sanitation operating practice in place, then you shouldn't have to worry. Others say, well, that may not be good enough. So where is it? I would say that, of course, assuming companies have a standard sanitation operating practice in place, that's a good start. But it's not enough. Because why isn't it enough? Because of how this virus spreads. It's not a foodborne pathogen. And we've just talked about how millions of virus particles could actually be spread in the air and on surfaces, high-touch surfaces and so forth, and then how we can infect ourselves. So those dynamics are much, much different than, and the infectivity rate, there are not, is much, much higher than what you would have with a foodborne pathogen. So I do think additional steps have to be taken to ensure that food contact surfaces and high contact surfaces are cleaned. And that's what this slide shows here. I got ahead of myself a little bit. So before we talk about cleaning and sanitization, let's go through some definitions so that we're all on the same page. So sanitize means a process that reduces the occurrence and growth of microorganisms. Disinfection describes a process that eliminates many or all microorganisms, pathogenic microorganisms, except for spores. So disinfection is more rigorous than sanitization. Cleaning is the removal of visible soil, which could be organic or inorganic, from objects and surfaces. Okay, and that cleaning is an essential first step before sanitization or disinfection, because any inorganic or organic materials that remain on the surface of instruments or food production utensils or food contact surfaces, etc., will interfere with the effectiveness of sanitization or disinfection. That said, environmental cleaning and approaches, environmental cleaning processes for SARS-CoV-2 is the same as for other common viruses. Foodborne viruses are non-enveloped, like norovirus and hepatitis A. They're more hardy, so anything that will remove them will remove SARS-CoV-2. So cleaning products and disinfectants are regularly used in hospitals, healthcare settings, food and food processing environments are strong enough to deactivate coronavirus and prevent their spread. And there has been some work, limited work, done in the hospital and healthcare setting. That's why I mentioned them with respect to disinfection. But the lessons from there are equally valid, I think, in the food processing environment. So the take-home message, though, is all visibly soiled surfaces must be cleaned before disinfection. And this is obviously a common theme, regardless of the microorganism. So even if we're talking about, foodborne pathogens in a food processing plant, obviously surfaces need to be cleaned before disinfection or sanitization. So that it's certainly no different with respect to SARS-CoV-2. So this shows a list of commonly used cleaners in the food industry, and really all of them are effective, would be effective against SARS-CoV-2, and certainly at the concentrations used. So really what we can say is that the products used to clean are good. and anything that you're typically using in a food processing plant right now will be enough to inactivate the virus. I just want to spend a little bit of time on this slide. This is something that came up recently. We certainly heard in the United States of people intentionally and accidentally poison themselves. But we're seeing in Canada a similar rise, at least with respect to accidental poisoning. Why? I think because of the previous, there's just not there's a lack of knowledge regarding how easy it is to remove the virus. I think there's a lot of fear, and people think that they have to make super strength cleaners to remove the virus, when in fact any typical cleaner will do that. So people are accidentally poisoning themselves because they're mixing cleaning products together, mixing things like vinegar and bleach, which leads to a chemical reaction and release of chlorine gas, which is very, very toxic. Mixing bleach with other cleaners, many of which have ammonia, which again will lead to a chemical reaction releasing toxic fumes. And if people are doing this and using it in an enclosed area, which typically happens, certainly we're seeing this more in the house than in a food processing environment. Then people can breathe in those fumes and become sick. So I just put this here to emphasize, no need to do that. The virus is not hardy at all. Common cleaning products will remove it. And so it's important to understand how to use those products. So each product should have a drug identification number, or DIN, on the label, which is given by Health Canada and shows it's approved for use in Canada. So certainly we shouldn't be using anything that's not approved. It's very important to follow the manufacturer's instructions. Clean, visibly soiled surfaces, we've talked about that before. So first, it's very important to do that before disinfecting or sanitizing, unless the product actually states otherwise. Bleach is commonly used. If it's used, it's important that it be made fresh each day, because the chlorine will dissipate or break down over time, and then that solution will not be effective at removing the virus. So it's important to make the bleach solution each day if you're using a diluted bleach solution. Okay, so let's move on. What about masks and gloves? What about PPE? PPE is increasingly being looked at as a way to prevent infection, certainly in healthcare settings, but that's imperative, but now in the community and also increasingly in the food production environment. So what about them? So I just want to talk briefly about masks and gloves, again, to address some of the myths that are out there. So masks, we've seen first, early on, we were told no need to wear masks. Then Public Health Agency of Canada came out and said wear masks in the environment. It's important to understand that masks are not there to prevent the person wearing the mask from getting infected. They're there to prevent the person wearing the mask from spreading virus to other people. Okay, keep in mind what we talked about with coughs and sneezes and speaking. Okay, so it's important that we understand why what wearing a mask will do and what it won't do. So it's there to prevent us from spreading the virus to others, not there to stop us from getting the disease. But as the article on the left really highlights, it's not so simple, because in order for a mask to be effective, it has to be worn properly. And I cannot tell you the number of times I've been out in public where people are wearing masks and their nose is exposed. It's just covering their mouth. That is a useless endeavor. We know that people can sneeze or exhale virus particles into the environment. So if it's not covering the nose and the mouth, then it's not really useful. We also know that it's uncomfortable to wear masks. So people will touch their face more often. And if the mask is contaminated and they touch the mask and touch their face, they can contaminate themselves. Also, especially when we're talking here about surgical masks, not the N95 respirators, because those, really the guidance is that we should not be wearing those because we need to leave those for healthcare professionals. So we're talking about surgical masks, which over time, the longer they're worn, they can actually break down, they become moist, and that decreases the efficacy of the mask with respect to stopping virus particles from entering the environment. So these are some things to consider when wearing masks. Not that wearing masks are bad, but they have to be worn properly, and we have to understand their limitations. Gloves, on the other hand, the guidance is don't wear gloves. There's certainly no need to wear gloves. And wearing gloves gives people a false sense of security because they're thinking as well, I have a glove on, so I don't have to worry about my hands. But we have to remember that gloves can become contaminated. And then if we don't take them off properly, we can contaminate ourselves. Also, if we wear gloves and we touch our face, we've contaminated ourselves. The skin is the best barrier against the virus. Washing one's hands and washing one's hands constantly is the best thing, the single best thing that we can do to stop the spread of the virus. So let's move on and answer some questions that I said we would get to in this webinar, at least that I explained in the description. Okay, so can infected food producers contaminate food with SARS-CoV-2? Sure, they could. They could sneeze on the food, they could cough on the food. So certainly there's been concerns about buffets, for example. As restaurants begin to reopen, what about buffets? Are they safe? I would say, and this gets into the next question, is COVID-19 foodborne? I would say that certainly hot food is safe. The virus is not heat resistant. 56 degrees Celsius will inactivate it. It's not heat resistant. As I've said earlier, there's certainly no evidence to support any idea that the virus is foodborne. Although certainly from a theoretical point of view, it's possible because of the fact that we have these ACE2 receptors in our intestinal cells, but the virus would have to survive through the stomach, the low pH of the stomach. It's not enveloped, it's not hardy. So I really think the chances of it being foodborne are very, very, very low. And we've certainly not seen any foodborne cases. What are the best practices when buying groceries? Should we, for example, bring them home and leave them in the garage for 3 days? Has been, again, spread through the media. No, we should not. One of the unfortunate effects of this COVID-19 pandemic, I think, will be increased foodborne illnesses because of the indirect aspects like this. If we bring groceries home and they should be in the fridge or stored properly, and we don't do that, any pathogens that are present in that food can actually grow and make us sick. There's certainly no need to do that. We just need to bring them home if they're and we can put them away in our cupboards and so forth. We don't have to wipe them off, although if one wants to with a disinfectant wipe, that's fine. But certainly there's no need to do that. But what is important is that we wash our hands after handling the groceries. Is takeout food safe? Yes, takeout food is safe. What about if we go into the restaurant to get the food? Is that safe? Yes, it's safe as long as we practice physical distancing. If drive-through is safe, we've seen some drive-throughs handing people their food or paying the kiosk, a little kiosk thing to pay with, attached to a hockey stick to ensure physical distancing. That's all fine. What about if we order takeout food and it's delivered to our house? We're seeing delivery companies develop best practices such as leaving the food at the door, pressing the doorbell and retreating away so that when the person opens the door, they're not coming face to face with the delivery driver. That's fine. Well, what about the fact that it can survive on cardboard or plastic, which are typically used in takeout as materials to put food in for takeout? So that's possible again. You know, so in that scenario, you know, take the food out of the container and place it onto another plate and so forth, and wash one's hands. So again, it comes back to washing one's hands to really reduce the risk of this virus and this disease. So final thoughts. We need to make sure we use disinfectants properly. Always follow the manufacturer's directions. Do not mix cleaning products under any circumstances. Diligent hand hygiene is the key to this whole thing, to reducing the risk of spreading the disease. And we shouldn't wear gloves. Properly wearing a surgical mask will decrease the risk of spreading COVID-19, but not one's risk of becoming infected. And we have to make sure we wear the mask properly and try to reduce touching our faces and so forth. And then this last thing at the bottom, this is actually a free course currently being offered by Johns Hopkins University in the US, and it's on contact tracing. And contact tracing is something that is going to become very important as you know, we open back up, because we're going to have to trace people and who they've come in contact with. Because you know, we know that there's a second wave coming, and we want to flatten the number of cases as much as possible. This course is free, and it's quite good for anybody who's interested. It's not just about contact tracing. It gives a good overview of the virus, of what we know so far, and other relevant salient features, such as how to control it and so forth. So I recommend it for anybody who's interested. So thank you very much for your time.
Thank you, Lawrence. It's Constance Wrigley-Thomas here, and actually I want to apologize for Rob. The Bell service guys were in his backyard and they cut his phone line, so he was unable to stay on the call, and thank you for your amazing presentation. In fact, one of the comments on the board was one of the best webinars on COVID-19 that they've listened to, so thank you for that. I just I think we have a couple of questions, so we have a little bit of time, so I'll ask you this first one. Is there any research regarding abuse of gloves in fast food establishments? That is like a continuous use of gloves. Are you aware of any studies on that?
Not for SARS-CoV-2. But I think, you know, I think we can draw, excuse me, I think we can draw our conclusions with respect to SARS-CoV-2 based on other studies that have been done in food establishments regarding misuse of gloves. And we know from those studies that, you know, if gloves aren't changed often, that increases the risk of cross-contamination. And if people don't wash their hands often, even though they wear gloves, because they think the gloves are protecting them, that increases the chance of cross-contamination. Given the fact that this virus is much more infectious than foodborne pathogens, I would say that, you know, we can draw on those and say that the same principles would apply to this virus.
Good advice. One of the other questions, actually, it was earlier in your presentation, was what does the, or how does the R0 value compare to other coronaviruses?
Good question. It's thought that, it's thought that this R0, I don't have the exact R0 values for, remember there's been 3 coronaviruses that are have been since 2002 that are really the concerns here, SARS-1, MERS, and SARS-CoV-2. I don't have the R0 values for SARS-1 and MERS, but I can tell you that the consensus is that SARS-CoV-2 is much more infectious. And with respect to MERS, for example, the infectious dose, where SARS-2, this current virus, the infectious dose is thought to be, you know, low hundreds to a few thousands, low, and we've used the example of 1,000. MERS is about 10,000. So potentially 10 times less or 10 times more particles needed for infection, which means it's less infectious. So certainly I don't know what the R0 values are for those others, but this one is thought to be the most infectious.
Right, which is why we're all self-isolating right now. Actually, a question somebody asked, will the slides from this talk be available? And just so everybody knows that we do record the webinars and it will be available afterwards. So not the slides, but certainly the presentation. And another question is, why is this virus found in meat processing plants, but not in other food?
Well,
Oh, sorry, sorry, let me clarify that. I just read that. Not in other food processing plants.
so I don't think that's actually true. In fact, we know it's not true. You know, I'm in Guelph, and just the other day, there was a report of a food plant in Guelph, a non-meat food processing plant, having people being infected. So it is found in other food processing plants. Why though? What's, you know, having said that, it seems like meat plants are where a lot of people are getting infected and so forth. And so if we want to ask why that is, or perhaps a better question is, what is it about meat plants, you know, that leads to that? I think, again, the fact that people are in very close proximity. You know, there's carcasses, depending on the size of the meat plant, you know, hundreds of carcasses, you know, and hundreds of thousands of carcasses an hour being processed. People in very close proximity. The carcasses themselves are moving past people, or you know, fabricated pieces of meat are moving past people. So people are coming into contact with other people. People are having to yell, as we said, so they could be spraying the virus into the environment. You know, it tends to be moist. It tends to be cool. It tends to, you know, these are all things that can very easily spread the virus. So this is why I think meat plants are so seem to be, you know, at the center in terms of the food industry of where people are infected. But it can be any environment, any closed environment, as we've seen with the restaurant case study.
Okay. And I'm going to take one more question and then we'll close things off. So I don't know if you can answer this, but can UV light used to kill the virus, can it be used to kill the virus effectively? For example, disinfecting grocery foods, cloth, cell phone, those sorts of things.
So UV light certainly is effective at inactivating the virus, just like other microorganisms. But we have to be careful. Like the example you said, foods, clothes, cell phones. You know, those surfaces are very different. I should note, which I didn't say, the virus will not survive well on porous surfaces. So that's something to note. For clothes, it's the same thing with cleaning. There's no need to panic here. Washing our clothes, like washing in a washing machine, will easily inactivate the virus. We don't need UV for that. A phone, like the surface of a phone, can you use UV? Sure. But I think, you know, to my mind, it'd be much easier to use a disinfectant wipe. Food, we certainly shouldn't be using UV on food. You know, again, keep hot, you know, it's the safety. Keep hot foods hot. You know, that will inactivate the virus. If it's on the food, which is porous, by the way, we don't have, there isn't what data is available, and I note that there isn't a lot of data, but what data is available shows that it probably won't survive well on foods, and this comes from previous studies done with other coronaviruses. So at low temperatures in the fridge. So I don't think we need to worry. What we do need to do is wash our hands. Washing fruits and vegetables, wash it with running water. We don't need, again, this was something that was in the media, using soap and bleach to wash our fruits and vegetables. That is definitely not a good idea, because we could ingest those things and accidentally poison ourselves. But in any case, we don't need to do that. Running water will be enough to remove the virus.
All right, well, that brings us to the end. Thank you, Lawrence. And on behalf of the Canadian Institute of Food Science and Technology and Food in Canada magazine, we thank you for your enlightening and extremely informative presentation. I should mention that in lieu of a speaker's fee, we will be making a donation in Lawrence's name to the Guelph Food Bank. Their goal is not only to help meet the needs of their clients in the short term, but also to help clients become self-sufficient and gain and maintain self-worth and esteem to eventually stand on their own with little or no help. So they'll be receiving a donation from us in your name, Lawrence. And then a reminder that we are hosting webinars every Wednesday for the foreseeable future. We have a few that we'll be adding to our website in the next few days. Next week, we'll be with Deanna Zinger of Food Processing HR Council, and June 3rd, Glenn Fraser and Johan Tommy of NNP LLP will be joining us for a webinar. That's it for today. Thank you, Lawrence, and thank you everyone for attending, and enjoy the rest of your day.
Thank you.